Hopefully you'll recognize trachea here. That's part of the larynx because that's essentially the thyroid cartilage. So sometimes they'll actually pull this out and you can see the epiglottis like flopping in there, but you actually have to cut it out. So it will be like way up here is where the epiglottis is. So remember that thing covers the glottis so when you like swallow and stuff, so food doesn't go down your trachea. So that's your trachea. Then behind that is the esophagus, which you can't see it all that well here, but you can see it really well down here. Here's the stomach. Check out this giant tube right here. The giant tube that's going to the stomach is the esophagus. So that's the esophagus, that's the trachea, that's what's left of the right lung here. So sometimes the dissection you can actually see, like here's the trachea, you can see the like primary bronchi going into the lung there. And on the other side where it's been cut off, you can just see like holes, like little, where the tubing is left. Can you see that? Mm-hmm. That's like for the primary bronchi, but they ripped off the lungs. Sorry, Kitty.
So, do you think they're like Karina repinned on that?
No. Yeah. But on the model, he's never going to miss that one again because he knew it. So there's the diaphragm. That's the esophagus. That's the liver. Yeah, diaphragm, liver. What's that little guy right there? That's the gallbladder. That's the stomach. And if you open it up, you can see the rugae. But the model will probably be used to tag things like, the fundus or the pyloric region or something like that. But that's the rugae of the stomach. This thing that hangs off kind of like an apron here, that's called the greater omentum. It's the greater omentum here.
Would that be tagged?
Mm-hmm. Could be, yeah. Greater omentum is a specialized kind of mesentery. Mm-hmm. That there organ is the spleen. That's the spleen. Sometimes that gets tagged. Hopefully you'll recognize there's only one of them. And then if you peel back here and look, most of this is small intestine. If you kind of fan it out, you can see what looks kind of like, like saran wrap or something. Those are the mesenteries. So the mesenteries have like blood vessels in them. And those blood vessels are carrying the absorbed nutrients. Eventually it'll get dumped into the hepatic portal vein and go into the liver. So, and then remember there's like superior and inferior mesenteric veins drain into the hepatic portal vein. So that's mostly all small intestine, probably mostly all jejunum, which is the middle section. But if you look at the stomach, which is in here somewhere, the stomach where it empties out into the beginning of the small intestine there, that's the duodenum. So right there, that's duodenum.
How far does that go? Like when does it change into?
It's defined as being like 5% of the whole length. So if they're going to tag duodenum, it would be like right after the stomach, like right there. If it was down there, it would be a little hard to tell. Is that duodenum or is that jejunum? So like right there would be duodenum. And when you look around there, you can also see this kind of brown stuff right here? Mm-hmm. And the brown stuff in here, that's the pancreas, which is kind of shaped a little different in the cat. So that brown stuff right there is pancreas here. That's the duodenum. And remember, the juices from the pancreas and the bile from the liver all get squirted out into the very beginning of the duodenum there. There's a little sphincter, which is the hepatopancreatic sphincter, and then behind it there's a little open space called the ampulla. So hepatic, pancreatic, ampulla, and sphincter are like right in here. So you'd have to cut it to see it though. So that's duodenum. Then most of all this squiggly stuff is the jejunum. But if you go to this thing, that's the large intestine, and it's probably literally full of poop here. So that's the large intestine, which in the cat doesn't do that, sigmoid and then ascending, descending. It doesn't really have that shape.
Would they try to throw you off and put sigmoid on the test?
No, not from the cat. No, it will be from the model. But you do need to know that's the large intestine or the colon. And then if you go to the end of that large intestine, like you're going back towards the small intestine, you can see kind of the end of, or essentially the end of the small intestine and the beginning of the large intestine. So the large intestine, this part here, the beginning is called the cecum. So that's the cecum. This is the ileum. And if you cut this, and sometimes it's cut on the test where you can cut it, you can see the valve between the two, which is the ileocecal valve. And it's usually really clear to the cat, so I don't have a scalpel, but we might want to do that on Tuesday just to see it, so you see it once, because sometimes it's real clear. Ileocecal valve between the ileum and the cecum. And cats don't really have an appendix, but they always have like a little lymphoid thing right there, which is kind of similar to our appendix, but it's not going to be tagged on the cat because they don't really have an appendix. Okay, so what do we need? Urinary. Okay, so there's the kidney, and actually it's still got some of the fat around it. So that's some of that adipose that we kind of talked about that kind of helps protect the kidney from damage. And then this little guy right here is actually that the gonadal vein and artery are going to. That's the ovary right there, like a little seed or bean or something. That's the ovary. And in cats, instead of a fallopian tube or a uterine tube, they have a uterine horn, which is this thing right here. And sometimes it gets tagged on the test. So
if it was
ovary.
on the test and then put fallopian tube.
I think that won't be one of your choices.
Okay.
It'll be uterine horn. So there's a uterine horn right here, and then I don't know if you can see it. At the end, it's kind of like a Y. It's broken off on the other side, but see that little Y-shaped thing? So they don't have like a big uterus like we have. It's like a little Y, and all this tubing in the horn is actually where, like, fertilization, there'll be like little kittens all along this here on both sides. In a litter, yeah. And we actually sometimes will get them. It's like, oh my gosh, there's a little kitty all along there. I mean, like a bunch of them. And then, so that's like the normal state for them. They can have a litter, whereas humans, it's not a good thing to have. Yeah. Well, it's supposed to get moved around, and then in humans, the body of the uterus is bigger, so it's supposed to hold the developing fetus. Okay. So I think I got most of those on there.
Is the lesser omentum going to be total?
No, it's like that,
Like
it's
can't
like
tell.
nothing, yeah.
Okay.
It actually is a little bit bigger, but